What causes depression? It could be anything. And for a lot of people, what's hardest is feeling like it's nothing. Nothing's happened. They can't point to something that caused this feeling that has just caused a load of other changes, and now they're in a bit of a cycle that they can't quite break. And I think that's one of the hardest scenarios, is when they can't identify a cause. Some things that we know can cause depression are life changes. Your parents splitting up, moving to a new area, losing a job, or being diagnosed with a brain tumour. I tend to use the phrase low mood rather than depression, because I think it can be helpful for some people to think, oh, do you know what, this isn't me, this is the depression. And for those people, that's a useful word. But for others, there's quite a lot of stigma attached to the word depression. And it can make them feel as though they've got another illness located within them. They are the holder of another problem. And that's quite a negative way to feel. So I tend to use the phrase low mood and just talk about low mood being around for people. Sometimes it's present, and sometimes it's shrunk right down and it's small enough to live alongside. To get a diagnosis of depression, you would need to be experiencing a depressed mood, or a significant loss of pleasure, and that's called anhedonia, where you're not able to experience pleasure. In addition to that, you would need to experience at least 4 other symptoms, and they could be able to experience pleasure. So just not having much energy, change in appetite. It might be that you're eating lots more, or that you're just not hungry at all. Changes to sleep, so not being able to sleep or sleeping too much. Feelings of worthlessness, feeling like you need to move around a lot more, or like your body just doesn't want to move that much as it used to. Recurrent thoughts about death and dying is really common as a symptom. And diminished concentration and thinking abilities. So people have to have 5 out of those 8 symptoms. They have to have them for a period of 2 weeks or more consistently without any let-up. And they have to be severe enough to impact on that person's functioning, either at work or with friends or at home, their ability to carry on their life as they have done before.